Okay, thank you. All right, thanks, Cindy. Welcome, everyone, to the East Labush Community Partnership monthly meeting. We appreciate you and your patience. Thank you so much for just, holding tight for us. I'm Rebecca Holmes, Director of the Partnership, and we're going to get started with today's agenda. Cindy, you can go to the next slide. Okay, so we have our welcome East Labush Community Partnership updates. We will have a panel discussion today, program updates, as well as closing remarks. Okay, so for those of you who are new to our space, we have a newsletter that goes out, actually it's bi-weekly now. And it's an amazing opportunity for you to share any events that are going on. So you can definitely email readc@jccany.org and just, send her whatever you need, and then we'll be able to put them in our newsletter. And then we also have our monthly meeting presenter form. We're gonna put that in the chat in case you would like to join us in person and actually present to our participants. Okay, so we have our virtual open door. It happens once a month, the second Thursday of each month at 7 p.m. And this is just an amazing opportunity for residents to come together to hear great information, but also we leave it open for them to share information as well. So if you would love to participate in Open Door as a presenter, you can definitely reach out to Cindy for that as well. And we have our monthly meeting. You guys are here for it. Definitely encourage you to join us in person. We are at an amazing space here with My Time Inc., Parkside Avenue. Would love to have you come in person and join us. And our website is here, eastlabushpartnership.org. On our website, you can find events, you can find just different information about the partnership. And so that's a great resource for you as well. We have one past event to share. It just happened this past Saturday on the 22nd. It was a Black History cook-off event and it went very well. I'm super excited that we were able to partner with the same chef as we did last time. And so I'm pretty sure that, it was something that families look forward to and had a chance to enjoy some good food as well. Okay, Edwin. Ella's gonna take it over from here.
Hey, good afternoon, everyone. Again, my name is Edeline, the administrative assistant. So in the chat, if you are a resident, please type your name, email address, and the word resident in the chat. And if you are a service provider, please type your name, email address, and organization in the chat. Okay, so today we will be starting off with a panel discussion. First presenter will be Emily Turning, hope I'm pronouncing it correctly, from the Health Content Manager of the Borough of Environmental Surveillance and Policy, New York City Department of Health and Mental Hygiene. So we will be discussing health and data and how it affects the environment. So to start off, we'll have Emily introduce herself.
Thank you so much. I'm Emily. I work at the Department of Health and Mental Hygiene in the Bureau of Environmental Surveillance and Policy. And I'm just going to talk a little bit about the Environment and Health Data Portal, which is just a tool to kind of look at environment data and health data side by side at the neighborhood level and just make connections between how New Yorkers experience environmental issues differently and how it affects their health.
Okay, second up, we have Lori Hilser, Managing Director of Mobility, Learning and Action in VETS, Mobility Labs, Robin.
Hi everyone, I'm Lori. I'm the Managing Director for the Robin Hood Foundation's Mobility Labs program. I just told folks in the room earlier today that I'm from Brooklyn, not just Brooklyn, but Brooklyn, by way of Brownsville, born and raised. I come to this work really being a champion for anti-poverty efforts across New York City and in other parts of the country. And looking forward to sharing more about what I've learned and also hearing more from you all about the work that you're doing and how we can.
Okay, so we do have some questions from panelists. So first question would be, how does the New York City Department of Health and Mental Hygiene use environmental and health data to inform policy decisions? And what recent trends should social service providers be aware of?
I just noticed someone said it was a little hard to hear. Should I go closer to the burger? Someone said that. Yeah. I can speak good. Should I push it up? Okay. Yeah, sure. I'll just go a little.
How are you guys hearing? Are you guys hearing us okay?
They said just a little, it's good, just a little far, you have to turn your volume up on your device.
I'll just go over here. Okay, is this better?
Okay, Natasha put a thumbs up.
Okay, great. That's a really great question. So we have on our website, which, I'll just let everybody know, and also we put it in the chat, but if you Google Environment and Health Data Portal NYC, it will come up. The URL is a little bit, has a lot of numbers and letters in it, so it's hard to remember. But we use different kind of methods of explaining data and explaining those connections between environment and health issues on our site to kind of connect the dots between policy and between some disparities that we see across the city. So one quick example, we have a data story, which is just kind of like a way of looking at data and providing a little bit of context on like why things the way that they are and not just the data itself. So one example is that we looked at how air quality changed over time throughout New York City and throughout different neighborhoods, and we noticed that emissions from commercial cooking were rising. So in 2015, they passed regulation around cooking emissions to try to improve air quality. So yeah, here's an example.
Great, thank you. Does anyone have questions? Anyone has any questions? You do, you could unmute yourself.
Yeah, I have a question. Yes, so my name is George State. And I live in East Flatbush. So my question is regarding the air quality and the home often is the air quality checked in the area. Yes.
It's a really good question. I think it's on two like intervals, I believe. And if you look at the New York Community Air Survey, which I can also share in the chat as an additional resource, that'll give us more information about that. And then we also have real-time air quality, which records certain air pollutants on like an hourly level. So those will give you like different information, but they're both.
Yeah, so the area is like one side is industrial area, and then right across the street is residential. So we have a lot of industries around there. So one of the industries is trying to expand. But we have not, we don't know when was the last time air quality was tested. But I know we have a lot of sand and then in the air, because every morning we wake up and see sand all over the car. So things like it's going in the car, so it's going to go downstairs. So yes.
Yeah, definitely. That kind of industrial areas. Yeah, I can definitely connect everyone with our air quality director. She like, I like write about these things, but she like really worked on them and create those policies, so she might be a good resource.
So it's possible to go on the website and request.
We can look at data in particular areas, but yes, yeah, on the website you can see like where the monitors are.
Okay, so you.
Yeah.
So we have a question for Lori. So the Mobility Lab initiative is focused on long-term solutions to poverty. What key strategies have proven most effective, and how can social service providers play a role in sustaining them?
Good question. I think there are many strategies. I don't know if any of them have proven to be, have eradicated poverty. Obviously, we still have an issue. I think we could start with some of the most vulnerable populations and thinking about children and childcare, particularly in New York City. We know that we have an issue with access to quality childcare, so continuing to develop programs that provide that access and support that access. I know as a foundation, we are committed to funding in the space of developing quality childcare. Looking at the current administration, I know we face some challenges. We're continuing to think about the child tax credit and the way in which that has elevated children out of poverty. I think it was back in either 2017 or 2019. I'm getting the years confused, but continuing to make sure that policies like that are still in place. And so for any organizations that are doing advocacy work, that's definitely an area where continued advocacy efforts can be useful. And I think some of the basic things that we know to be true, which is access to education for adults, always helpful to see 2-gen models at play. So where there are programs that are supporting adults who are receiving education while also supporting their children within the educational system, I think is always a plus and a benefit. Something that I think is emerging or that could be added to these models is increasing opportunities for community building and connection between parents who are pursuing education, and sort of creating a bit more of a communal aspect for example, single moms who are trying to get a bachelor's degree, making sure that they have those connections within themselves to have that continued support is another example. And then also thinking about making sure that the infrastructure, the built environment continue to be improved. So access to quality housing and affordable housing continues to be a conundrum. I don't know if there are any housing oriented programs on the Zoom. I used to work in a shelter and work in the shelter system and within the voucher system. And so definitely understand the challenges with being able to find an affordable apartment here in New York City. So continuing to think through ways to make apartments more affordable, I think is still high on the list. When you look at communities like Brownsville, where I'm from, a lot of the money that we've invested into that community has gone into infrastructure building within the community. So really being able to work with developers and think about what it is to have a stronger fabric and ecosystem amongst organizations so that they can better absorb capital coming into the community. I think now more than ever, with the way federal grants have been attacked, it's important for organizations to think about, well, how do we partner more effectively to use resources that might be more limited for a period of time? And how do we identify the programs that we can best target those resources toward, even if it's just for the short term, to get through where we are with this administration?
Thank you. Does anyone have questions for Lori? Any questions? If you have questions, you could unmute yourself in the chat. If not, then we'll move on to the next question. This question for both of you. How can social service providers leverage data on health, environment, and poverty to improve services and advocate for meaningful change?
Yeah, so you were mentioning housing, so we have a lot of data on the portal about housing maintenance, or like lack thereof maintenance, and how that varies across neighborhoods. So you know, looking at things that compare neighborhoods is a really good way of figuring out which neighborhoods need the most resources as far as like something like housing maintenance or air conditioning access, or pest control, or, you know, things of that nature. So I know a lot of community-based organizations will use our reports and our data to basically just, you know, explain what issues need the most attention and where, and that can help drive like programs and services, and things of that nature. We also have the heat vulnerability index, which some of you may have heard of before. It just compares which neighborhoods are most vulnerable to heat-related illness and death. And, you know, that map lays things out really clearly. I can show that as well. And I know a lot of like policymakers and educators will reference that, as well as people from organizations to, you know, just say like, look, people are experiencing heat at a much higher level, and these are the reasons why, and like, this is what needs to happen, this is where we need more resources, more funding, and better communication.
Okay. Question then,
Lauren, do you have anything to add to that?
I feel like what I have to say may be related to all the questions, but I'll say it anyway. I think we are fighting a bit of a different battle in the next couple of years and decades to come. I think it is more a battle of narrative, and not just in the provision of the programs. And so I think that I would say in terms of how you leverage data, it really is to tell more compelling stories about the people that you serve and how the work is impacting those individuals and changing those lives. And I say this because I think we have this identity of poor and poverty that gets sort of put on to people in certain communities. And I think it's really important to shift into how we start to tell more asset framed stories. A lot of the work that we've done within our initiative has centered around narrative change. And so how do you acknowledge the realities that you are confronted with, but also bake into that the stories of how people's lives are being impacted by the work that you're doing. And so looking at some of the data from the health department, I think it's looking at, well, what was the before, what was the after, and what is the story that we can tell here so that we can continue to humanize the experience that people are having and not just sort of look at it through this lens of poverty and scarcity.
anyone have questions in the chat? You guys are fairly quiet today.
I have a question.
Anyone have questions?
What are the biggest misconceptions when it comes to using data in social services or the work that you do? And how can like we or organizations like overcome them when you think about them?
It's a really good question.
I feel like for our community, the data we collect, sometimes they don't really tell the story of the community or the struggles, right? Sometimes there's numbers that cause that misconception of what the community may need.
Right, and I think that's the point that I was trying to get at, which is you have to bring a storytelling element into the data. You have to marry the qualitative with the quantitative. Especially there's some spaces where people are trying to move into a more co-created data space, meaning it's not so much that as an entity, maybe as a foundation or a city agency, we are just dictating what the data is and how it should be used, but that communities from the ground up are also able to say, well, these are the issues that are more important to us based on the data, or this is the data that is more useful to us, or this is the data that we need you to collect. And part of that, I think emergence can benefit from some of the storytelling, right? I think it's sometimes easy to get bogged down into this. Hey, Kelly girl, we can Al. I think we get bogged down into the numbers, and I think if you think of it like a credit score, right? We think about how rating systems are used, we think about credit scores. Everyone gets this credit score and different things may happen that impact your credit score. You may get a negative credit score, someone else can have a positive credit score. But we may not have the whole picture of why the credit score may be lower, for instance, right? And so how do you color that with additional data and information so that people can understand what's really happening behind some of the numbers that they're seeing. So.
Great. Next up, how can cross-sector collaboration between health, housing, education, and social services be strengthened to improve community outcomes based on data insight?
I could start, I'm only gonna jump in because in my work, I think a lot of what I've funded and what I've seen is different forms of what they call collective impact, different forms of collaborative structures being built within community systems to try to streamline and evolve the way in which some of these problems are dealt with. So I would say, when you're looking at health, housing, education, and social services, small things like, for example, one of our partners in California used the no wrong door approach, which meant that if 5 organizations were working together and they each had a specialty, but if I came in off the street to any of those organizations, there was a clear set of directives on if this organization wasn't the right organization, there's a process to make sure that this person gets to the organization that they need to get to, and also that we don't lose that person, right? Because sometimes I come into one organization and I'm told this isn't the right place, and then I may not come back, right? Because maybe it took all of my effort that day just to get to this one organization, and so making it easy for people to navigate between organizations as best as possible, I think is helpful. And then also thinking about how you can take services to people. One of our partners in California, their project was to create a van. So you've seen this with legal services, different types of services where they have mobile units. And there was a particular housing development that didn't really have access to services. They noticed that people weren't coming to the services, and so they created this mobile unit to say, okay, well, why don't we go to those people? And so thinking about, how can you kind of meet people where they are to be able to bring them into the system a bit more. We know that oftentimes people don't tap into the safety net benefits and the things that they have access to simply because they don't know, they may not understand how to access them through the system. And then I think the third thing is, if you are working together as an organization, having a vision and being very intentional about what that structure is going to look like and taking it seriously, because there's some very powerful cross collaborative structures being formed at the community levels. But they take a lot of work and planning and effort and MOUs and all the different skeletal pieces to kind of make those things function as effectively as possible. So within this particular group, thinking about, are we working together as effectively as we can, or can we bring more structure to the table to better facilitate the cross collaboration within the community?
I just want to go back one question.
Yes.
Quickly to the misconceptions one. So I just thought of a good example. And if you don't mind, would it be okay if we share our website or something that would explain
The
better?
one link that you shared?
Yes,
Yes.
thank you so much. So we did a data story that kind of like tries to look beyond just data and explain like an issue that people have misconceptions about. So this one is also about air quality, and it looks at different at how like the top 10 neighborhoods that experience the most air pollution are not the same as the top 10 neighborhoods that have the worst health effects from air pollution. That just comes down to disparities across race, across resource access, and things like that. So we kind of explained why that is, and it helps illuminate why, just looking at one thing in one way sometimes can lead you to draw conclusions that don't really give you the full picture. Yeah, that's our website. At the end, if you wouldn't mind, I would love to just like show what some of the data stories look like quickly if we have time.
Oh, you can just share it now.
Would that be all right?
Yeah, sure.
Thank you.
And I'll share, one of our partners in Flushing developed a campaign called Undo Poverty Flushing, where they worked with some film directors to basically create a short documentary to tell the stories about poverty from their perspective. And it was nominated for several film festivals, and I can share the trailer for that, just so you can get a sense of how could storytelling and narrative work be used as a part of your data journey.
Yeah, and just to add on to that, if you wouldn't mind clicking on housing, this can just kind of give an idea of, yeah, if you scroll down a little bit more, so we have like the heat vulnerability index I was mentioning before, if you wouldn't mind clicking on that, and then yeah, people can explore on their own, but you can enter a zip code or a neighborhood in this little box, and that will populate the map below it and show heat vulnerability. Awesome, and it kind of like aggregates zip codes in different ways depending on how the data is organized. But
4 out of 5.
yeah, so you can see, I think this is a really great example of kind of like breaking down a lot of data into this metric that is really easy. You're like, wow, 4 out of 5, that's really high. And then it gives you more information, but I think this is a really good, we were talking about interactions between different industries and different disciplines, and I think having a tool like this allows people to quickly get an idea of like where resources are urgently needed, and kind of some context behind that. And then we have a lot more explanatory pieces like this on our site. So yeah, I just wanted to quickly show that. If you scroll down a little bit more, there's this interactive map which shows, yeah, you can hover over it and see the score of different neighborhoods, and then there's information explaining how we came up with that score, how it's based upon data, and how, you know, air conditioning is a really key health intervention, and things like that. So anyway, happy to chat more about that if there's questions, but I just wanted to.
Shabir, I appreciate you sharing that, you know, I don't know if anybody from Brooklyn Level Up on, maybe if, you know, tap into it a little bit more, but sometimes, like you said, when it comes to data, right, you hear the heat index is like, what really is that, but how does that connect to housing? Even the structure of housing in our communities versus other communities, because one of the things that Brooklyn Level Up, George, you remember, they had a presentation, well, a kind of, not a presentation, but you could visit and see how there's other communities that have more like landscape, trees and grass that's built into, even how the landscape, like the buildings is built and stuff like that, that contribute to a lesser heat index versus the communities that some of us may come from that has those high heat index.
Yeah, and it's one of the factors that was used to calculate the index is vegetative cover, which I guess is like a technical term based on satellite data, but yeah, bushes and trees. So yeah, that's one of the 4 factors used to calculate vulnerability. I believe income is also on there, you know, all these things are connected, and access to the, yeah, exactly.
So if we could stay on this example, I would then say, if you were trying to work across organizations, you would use something like this to identify for your particular community. If you're interested in, say, climate justice, there may be some elements in this for your community where you're a 4 or 5, and you know that that's an issue. So then you want to think about strategically, well, which organizations are either working on this issue or can work on this issue? And then you bring those groups together to sort of form a structure around how you will collectively use the data to either do advocacy work, to strategize a vision or a plan for the community as a whole for how you might address this in the next 10 years. Who are the funders who might be willing to fund work in this space, in the climate justice space, and then you develop your strategic plan and your action plan from that. And so that's kind of the way I think when you ask about like the data plus how the communities sort of work together, it's really in that component.
Well, I really appreciate you also giving an example of how to use it, because sometimes when we're giving out these services, we kind of just give it out and not giving any information on how it can kind of be utilized. And so I really appreciate you doing that, because that actually showed me how I can utilize it.
And this is true for any data, so I think good thing about the city is they have a lot of these types of interactive maps for different issues. I think if we're specifically focusing on housing and health, like everything is so interconnected. So I think it's just helpful for you to be able to see, and I mean, for me, when I look at these maps and I see my community in the dark red, it then makes me angry, right? But then I can also see like, what are the other communities that are in dark red? And so even if within, say, my zip code or my immediate area, I have a coalition, I might wanna think about, well, are there other groups with this dark red data who would be interested in other parts of this neighborhood or other parts of the city in working on this issue? And that's how you start to build more of a collaborative effort, more of a movement around the thing that you're trying to tackle.
And I can see how it can be connected, because you wanna address that heat issue, but then something that can help the youth, bringing a youth program together to address it. Now you're addressing the heat issue in the community, but also providing more youth activities as well.
Right.
You bridge those things together, so it really helps out, but again, it's very hard sometimes to look visualize how that data can really come into action with the work that we do.
Great information. Lastly, last but not least, what tools or resources would you recommend for social service providers looking to integrate data-driven approaches into their planning and decision making?
Well, yeah, I was just gonna say, I think our website is a good tool for people. There's tons of content that is similar to that map. Some of them are more narrative based, so it's really just a story that's kind of anchored by a few really powerful charts. Like we have one on housing and health, and it shows that I think over 50% of New Yorkers experience rent burden, which I think is like 40% or more of your income is spent on rent. And then we really go in depth on that issue. So those are great for a personal level of understanding, but they can also be shared in like a classroom or in advocacy work or with a policy person or organization. So I think the portal itself with its data and with its various narrative and like interactive tools is a good example. But I was also gonna say we allow people to download and use any of our data. It's all, anyone can use it pretty much. And we use a tool called Data Wrapper to visualize a lot of the data. It's pretty easy to use. You can also get really, really in depth with it. We're also happy to answer any questions about how to download our data sets, how to look at them. If you notice something isn't there that you want, we can always try to answer why it isn't, or maybe it's, you know, on its way or something. But yeah, I would highly recommend, if you want to download it and use it for your own charts and your own presentations, that Data Wrapper is a really good resource for kind of visualizing it.
I have a question, I'm not sure if you discussed it already, but how was the data collected?
Great, yeah, both great questions. As you kind of like jump around the site, you'll see that some hasn't been updated in a while. There's various reasons for that. Sometimes data just takes a really, really long time to be collected and organized, and like sometimes we're short-staffed, or you know, it comes from a survey that's done like every 3 years. Like I think the housing and vacancy survey is every 3 years. Or sometimes people will ask a question for a long time about something on a survey, and then they'll stop asking it, so maybe we won't have any more data at that point. So it really varies, but we're always happy to answer questions about specific data sets. I'll also include our email in the chat. And then the other question, how is it gathered? Yeah, kind of similarly, it comes from a lot of different resources. Some of it's census data, which some census data is being impacted, but some of it is from from various surveys. Some of it is collected by different bureaus within the health department. Some of it comes from like the Department of Transportation. Like we have a lot of active design and like walking like distance from a park access is related to health in certain ways. So yeah, it really comes from many, many different sources.
And I would just say, we actually just yesterday released our annual State of Poverty and Disadvantage in New York City, which is volume 7. So if you go to the robinhood.org website, you can see a report that is across the city. And I believe we do this in conjunction with Columbia University, and you can get a look at all sorts of data points from housing to education to mental health. You can really see how different individuals in different communities are impacted by that. So I would definitely, from just looking at how to identify solutions to poverty long term, it's a really good resource for pulling data and metrics across the city.
I have a question. Does the 311 complaints have an impact on our collection of data and how often you do the environmental studies?
That's a great question. I can probably connect you with someone that could answer that more in depth, but, on a broad level, we, at least on my team, the portal team in particular, like, we don't review 311 data ourselves, but they do review it. And it does, do you have like a question about a specific type of complaint?
Well, yes, for instance, because I know in my area, I was complaining about the smell and the sand and all that, so I was just wondering if you have access to the 311 complaints to see, oh, we may need to do more testing in this area, so.
Yeah, we do on, I think NYC Open Data, there's a lot of 311 complaint data sets. We also like, I think we're talking about coming out with some content about why 311 complaint data doesn't always correlate with like what is actually happening, because sometimes people see something and they call, and sometimes they see something and they don't call. Maybe more calls come from like one person or something, so it's a good way to look at data about certain topics, but it doesn't always tell the complete picture. I know that doesn't fully answer your question, but I will, yeah, I can definitely look into the environmental studies.
And I don't know if this was mentioned before, and I missed it, but also like in medical records, for instance, each publish, we normally have like the birth defects and like the peer mothers who postpartum issues. So I was wondering if that's taken into consideration too, because I know East Flatbush have quite a few, I forgot the terminology, but women who died.
Yeah, we do have data on birth defects and, yeah, I think a lot of it is fairly out of date though, and I think that had something to do with reporting from one agency or like maybe at the state level to another. But I can also get you a better answer on that, but we do have some.
Emily, do you mind touching on that a little bit more? What are some other gaps or challenges exist in collecting or utilizing health and environmental data, and how can, I guess, like organizations like community organizations help bridge them?
Some other gaps, yeah, that's a really, really good question too. I think just by the nature of like government and also community-based work, like things don't always move the quickest just because, I don't know, it's like, it's not tech or something like that, so it feels like it's always under-resourced, unfortunately. And I think that sometimes why it takes a while for things to get updated as much as we would all like. At the same time, data that is a few years out of date is still really valuable. It can still show us trends, it can still show us where things need attention or need to be addressed. So that's something that we always like to just say, like, even if something hasn't been updated since 2017, it's still valuable, if there's like several years of it to show long-term trends. And how can we address that? That was the second part of your question, right?
Well, how can we help help you bridge them or assist in any way?
Oh, like help us?
Yeah.
That's a great question also. I'm not sure, I will definitely think about that, though, I think just like we always go through our inbox, and whenever we get questions from people saying like, hey, I'm looking for data on this, where is it, or like, I'm trying to do this project, like, I know that it makes all of us feel really eager to help, so, yeah, I guess, like, feel free to contact us. We're also working on a few upcoming projects that are more like qualitative data based. We're inviting people to share their experiences around heat vulnerability, and we're going to post those. If people want to do it like anonymously or with credit, we're offering both options, but yeah, I think more qualitative data is helpful to kind of bridge the gap if we don't have quantitative data, and also to just like illuminate quantitative data in a more personal way. Oh yeah, and also if you have ideas for data stories or something that we haven't explored, like feel free to email us. We're always looking to partner with people on these and like get them out to our audience.
Yeah, one of my biggest concerns always is to make sure when the city and any or whoever's collecting data, how make sure that all voices are being included. So that initiative that you mentioned, we'd love to hear about and be able to share with our community to make sure that they're able to share and their voice is being heard when that information is being collected. Lori, I just have a question for you. What are some common barriers to that you, I don't know, maybe seen that's you've experienced or seen when it comes to implementing the most effective like poverty reduction strategy, if that makes sense?
Oh.
Sorry.
That's the save the world question. I mean, I think everyone on this call probably knows what a lot of those things are. I mean, the loss of funding. When funding is inconsistent or too short term of an investment, I think that as someone who works in the funding space, I know that can be problematic. I think from a data perspective, it's not having data, not having the right data or collecting the right data can make or break the programs that you are developing and running. And to add again to the point that was just made, it is not coloring that data with the stories and the qualitative aspects of it. So I think those are things that can definitely go a long way in terms of making programs more sustainable and being able to pivot. I think a lot of times we get wedded to, it has to be this thing, this particular program, and then we see things happen where someone loses funding and the whole program goes away. And so it's, how do you have some nimbleness and flexibility in your programming to really be able to tackle an issue from different angles so that you're not stuck to one path forward, and if something happens then that program no longer exists, because it's almost like running a race and then suddenly being taken out of the race and being told to start over.
Right.
That always causes a bit of a deficit and a setback.
Yeah. Does anybody from Zoom have any questions? I know it's a hard topic, but it's an important one, and this is something that came up during a debrief in the actual general meeting that was requested from this group of people. So if you have any questions or confused about anything, say, I don't understand, please explain that a little bit more.
I can read what we have in the comments so far.
Okay.
Kelly, yes, wonderful, thanks for the tips. Karen also mentioned it's a great conversation. Yes, Alex, I just wanted to say thank you to both. This was so, it seemed that we made me think creatively of how we can approach data differently to better empower the communities that we represent. Amanda said, thank you.
I think if I could add one thing, I would just say to also be clear that there's the use of data and then there's the collection of your own data. And I think that making sure that you have a plan for both of those, like what data do I need to use from other sources like the Department of Health, and also what data do I need to collect? Either to support a program, to make a case for that something is needed to build an advocacy case. And then within that, breaking that down a step further to say, there may be numerical quantitative data, and I may need to supplement that with the qualitative storytelling, narrative-based data. And then once you have that, if there are things that you want to change or do differently, you think about how do you manipulate that data to support the thing that you're actually trying to accomplish, right? So there's qualitative data to sort of elucidate something that already exists, but there's also taking a problem from a storytelling perspective, like let's say you want to talk about affordable housing and you want to tell the story of why it's affordable, and you want to color that with data, and then you want to make the case for changing something within the affordability conversation. So you want to tell stories that support the change that you're trying to see. And you want to find data that supports the change that you're trying to see to be able to create a cohesive picture of what that might look like. I hope that makes sense.
Thank you. Emily, did you have any last comments that you wanted to make?
Oh, I just wanted to share our email in the Zoom chat. I'm sorry, I'm not connected to the Zoom. It's just
I want to share your.
oh, sure, yeah, here. Well, our team inbox is just EHDP.
Wait, say it.
Oh, sure.
Say it again.
EHDP at health.nyc.gov.
At health.nyc.gov.
Yeah. Yeah, and anybody can, like, please feel free to reach out. We're a really small team, so someone will definitely see it. And yeah, if you see a topic you'd like to see represented in a data story, or a feature or something like that, or you have questions about how to use or download any of our data, we're always happy to answer.
So Kelly has a question, I don't know if she wants to ask it herself, or if you want me to, read it out loud. You want me to ask? She said, how can we use the data to not only empower the community, but keep the community empowered? That's a great question.
Well, I would say something that I always say is that the power is in the collective, and the more you can make the data accessible. So if you're having community meetings or spaces where you're bringing people together, really using those spaces to tell people through the data, like what is actually happening in your community. Like, these are the statistics of homeless people in your community. These are these are the educational outcomes in your community. These are the health outcomes in your community. And people might be angry, right? Because sometimes most lay people, we don't go in and just peruse data. Like, we know something's wrong, but sometimes we don't understand the magnitude of exactly what's happening. So like at the community board, having moments where you're able to infuse data into the different issues that are coming up and being discussed so that people have the full picture. Show that data in comparison to a community that's doing well, right? Like, here we are with 70% of the people who live here are having housing insecurity, but when we look at a more privileged community, the number is 20%. Why is that? What does that community have that we don't, and how do we create that for ourselves? What do we need to do to build that for ourselves? Is how you then give the power back to the community to begin to organize and create a vision for the community around what this community can and needs to look like.
Yeah, and just to add to that, if you go on our site, there's a neighborhood reports section, which just compares each neighborhood to each other across, like, I think it's 5 different kind of meta topics: climate, air quality, housing, I think children's health is one of them. But yeah, if you click on that section of our site, it will allow you to make those comparisons. And then there's like bar charts, trend charts, everything is just ready to go. There's a print option, so if you want to print it out or send it as a PDF, you can use it, present it, share it. So yeah, that's a good resource for making those comparisons.
And with the you see that? It was the same link that I was
Yeah,
on
yeah.
already?
Yes.
Ready to go?
Absolutely. So go to, explore on the, oh yeah, you can type in neighborhood reports. Oh no, sorry. Type in Flatbush. Okay, great. And then click on neighborhood reports oh yeah, right there. Thank you. So yeah, if you click on one of those sections, yeah, climate and health is a great one. Let's click on that one. So then you can see like for surface temperature, like we were talking about earlier, you can see where it falls. And if you click on, yeah, like health outcomes on asthma, emergency department visits, it's worse compared to other neighborhoods. And if you actually click on where it says asthma ED visits, it will open up like a more in-depth look at like why that breakdown is the way it is and give you a lot of different statistics.
So can you explain, and I feel like this is important to see,
Mhm.
the difference between East Flatbush versus Brooklyn and New York City, knowing that East Flatbush is the higher. Like, what's the differential there?
It probably comes down to differences in those factors listed above, like air pollution, and then housing maintenance is a really, really big issue in terms of asthma emergency department visits, especially for kids, which this is talking about. So, you know, things like PAS, mold, and just like lack of maintenance, houses that are too cold or too hot can trigger asthma. And so it's very possible that housing maintenance is just worse in East Flatbush as compared to Brooklyn as a whole, I guess, when you average everything out.
So what that is telling you, I just wanted the data person to say it, because I'm not a data scientist, but I can tell you what this just said. It just said that East Flatbush is worse as a neighborhood in this particular statistic, like as compared to the borough of Brooklyn and the city of New York. That is what this just said. So when you, to go back to Kelly's question, when you think about how do we both empower and then keep people in power, it's, you have to understand, because sometimes we're running programs and we have 50 people coming in and, you know, they look good and everything's great. But you have to go back to data like this and other data sources to understand, well, where are we relative to everything else? And then what is that telling us that we need to be trying to think about or do differently to understand how we change this number and the future outcomes for all the people and children that are in this statistic, right? And that's the organizing point for you all as a community and as a collective group of organizations to sit down and say, if we look across the board at these numbers, and I'm sure if you go in East Flatbush, just like Brownsville, where I'm from, a lot of these numbers are gonna be not great for brown communities, right? That is the clarion call to action to say, okay, if we want to change these numbers, what does that actually look like? And it goes a step beyond just running the program. You have to develop a vision for the community, and you have to work backward from that vision in order to understand how you build that out over a period of time. And you have to use the data and the metrics to track the success of the programs and the things that you implement over time to try to change these outcomes and these statistics.
Yeah, well, actually go a little further to say like East Flatbush and Flatbush maybe should be divided because East Flatbush have a lot more industrial areas, including junkyards, on all the carting companies and all that. So I could bet anything that the East Flatbush area is much higher than the Flatbush. So even though it's at one, I'm having problems seeing that's 153, 154.
Yes.
Yes, I bet you anything that most of that, or even if they divide East Flatbush might be even higher.
Yeah, that's a really good point. I think we also have a data story on this, but sometimes the way that like public health data is collected is restricted by like how far down you can break a neighborhood or geography just because of like privacy issues. So that's just one reason why things might, like some neighborhoods might be joined together in some of these examples.
Right.
There's other reasons too. Sometimes they're broken up into like which hospitals, like hospital districts or zip codes or just like various ways of dividing up the city. But yes, yeah, it might very well be different if we separated that into two different regions.
I also wanted to say that it's also important for agencies to actually, it's great to do a community mapping. To find, who's there, double of services and, just resources. Some of the times your family is coming to ask you for certain things and now you could be able to know where to refer them to, so that will help. The rates to go down a little, if, doing community mapping would actually be great.
The question in the chat. Okay. Kelly again. Maybe Kelly, but she asked, does the system have any information on diabetes and Flatbush?
I think that someone was working on getting that data for at least our portal, which is only neighborhood level data. If you go to the very top of the page, there's that in the search area in the magnifying glass, you can type in like anything that you're curious about. I don't believe we have diabetes data currently. Yeah, unfortunately, I don't think that we.
Well, maybe there's a platform that could provide, you just may not know of it, but.
Yeah, I think there may be some on the general health department website. Our portal has certain data sets. Yeah, I can definitely look into that. I don't think we currently do. But yeah, any topic you're interested in, if you search it in there, all the related, like any stories about it, any maps related to it, will come up in the search.
But that portal is more focused on the environmental, not really the chronic piece to it.
If you can go to Robinhood.org,
Sure.
because I think in our printed report, we have some health. Click on research. It's not gonna be the same type of scroll down. It's not gonna be a tool, like a searchable tool. At least I could be lying, scroll down, you can keep scrolling down. Click read the report. So if you go into go up, read the report. If you go into the organization's research portal, and you can scroll down, this is volume 7, but every year they produce this report, which is pretty comprehensive, and it tracks individuals across a certain period of time, across different communities. And you can go all the way down. And it looks at different issues. It looks at health, mental health, education, housing, but this is looking at it, I think in both neighborhood, but also some individual statistics. So like if you wanted to see particular data points for Black people or in an Asian community, the report kind of goes in and delves into some of those data points. And again, we don't have a tool, but the research, if you are interested in just kind of getting a sense across New York City, like how different places are doing, what the numbers are looking like when it comes to poverty. You can check out this report as well as the reports from the previous 7 years. And then we have separate policy reports on the child tax credit, different aspects of the work that we fund, but also some of the policy work that we're doing as well that could be helpful for your communities and your organizations to look at.
Yeah. Well, thank you. Any other questions from the group, from Zoom? Well, I just have a simple comment, appreciate everything that you shared today, but it really kind of made me think about how could we cross-sector, different datas really to look at, different issues, cause, last meeting, we had, Shawnee from Live On New York shared about, becoming a donor, right? Yeah. I always say, and she shared information, she shared the breakdown of different organs that the community is in need of within New York City. And one of the biggest one was the liver or the kidney? Was one of those. And I think the number was 12,000 overall that are in need of that organ. But then almost half of that number was Black and brown. And then she connected that to health issues that are not really based on genetics, right? And some of it is like lifestyle. A lot of it is lifestyle that can be prevented. They don't even need to be on there. Most likely they wouldn't be on there if there was a certain kind of lifestyle they were living. But when you think about food that's in our community, that is brought into our community and other communities, I know like where I went to high school, the furthest fast food restaurant was like 45 minutes away. And I know that's community design, right? So when you think about stuff like that, that information coming together to really help communities understand why things affect their community in certain ways, and how can you take that data to say no to certain things that's in your community right now and how it's affecting it. Example, a list of for kidney and half of that being Black and brown. Yeah, but thank you for sharing all the information that you shared today. Appreciate it.
We also have, I think we have a data set on grocery store density, or like access to a grocery store versus like a bodega or like something like that. On the portal as well.
Yeah.
Yeah.
Thank you.
Or how far is your Trader Joe's? I want to Trader Joe's in my community.
Well, if you want a Trader Joe's, you can get one, but you would have to advocate with Trader Joe's and other people.
They were willing to come from my understanding, but people pushed it out.
Well, who put y'all
Mm.
in?
Now we have Starbucks. in Chapman. So it's like, look, it's changing.
Yeah. Okay. I'm going to continue the presentation from here. Anyone else think?
Give it up. Thank you so much. The information was very resourceful and, you know, a lot of us don't know a lot of things like this that's going on in the community, so. Thank you guys again.
Yeah, thank you.
Thank you. Give a round of applause on the chat as well. And Carmen
And Kelly.
Thank you so much, Kelly. Also, Kelly, well, I guess when we get.
Oh yeah, thank you guys so much. I look forward to attending in person though. I actually thought it was just over Zoom when I was invited to the meeting, so I'm looking forward to attending in person.
Kelly is just someone that we just met recently, this week I was communicating with on Instagram, so thank you for joining and thank you for answering the questions and being an anchor. Thank you.
Thank you guys for your service to the community.
We're not done yet. We're gonna program updates. We're gonna continue on the program updates. Give us a little bit of minutes while we put back up to presentation. Yes, George?
I just want to say thank you, especially to Sydney for inviting me to the meeting. This is my first meeting, and I really learned a lot, and I'm glad to be here, and I really thank you all for the information that you all shared, because it was very important that I was here today, so I started with a young, as I think I was speak last night, but I really appreciate you inviting me, and I'm really thankful for all the information that I received today. I will be sharing it with you.
So now we will be continuing with program update. So if you are not following us on social media, please follow us on Facebook and Instagram. Establish partnership. So for our next meeting, it will be March 27th, 3 to 5 same time. If you're able to come in person, we would like for you to come in person. If you can't, then you can just join us via Zoom, but in person, you know, it's a different experience, you're face to face and to get all the information that you need. And also the service, zip codes 11203, 11210, 11212, and 11, well, mine's a code 12226. And. Oh, we didn't do the program? Okay.
Okay. So feel free to unmute yourself, thank you, Edwin, if you'd like to share any program updates. And we're gonna stop sharing our screen, this is an opportunity for you to tell us what's going on in your world, let us know if you have any flyers you wanna put in the chat, we can share them with everyone. But feel free, we can have our program updates now.
I will speak. Hey, it's Kelly. Thank you. Thank you for having me. So I'm the community engagement specialist for Juneteenth NY, and so we just want to invite people to come out for Juneteenth this year, June 14th. It's at the Gershon Park there on Linden in Vermont. So we're just welcoming everybody to come out, and then like I said in the chat, if you're interested in tabling, that would be great. If you want to contact me, I put my email in the chat. And that's about it that we just have coming up. And if you have anything that we can possibly participate in just to get Juneteenth out there and still connect, I'm here to connect with that.
You, Kelly, anyone else? If it's your first time, please introduce yourself in the chat.
Hello, this is Luz. Can you hear me?
Hello.
Can you hear me here? Okay.
Yes, we can hear you.
Okay. So hi, this is Luz Martinez with the New York City Poison Control Center. It's great to see everybody. Just want to remind everyone, March 16th through the 22nd is National Poison Prevention Week. So please make sure you support our efforts. How can we do this? Make sure you have our 1-800 number saved in your cell phone. I hope at this time I'm not becoming repetitive. I've been saying this for the longest. I hope my community partners are supporting us in that effort. Make sure you have it in your cell phone. Remind everyone to save it in their cell phone. Now, also it was very interesting this morning. I was at a coalition meeting about alcohol. Think about it. Alcohol is also a poison. So just want to throw that thought in there, okay? Sometimes people just take it very lightly with alcohol, but it is a poison. Anything that makes you sick or kills you is a poison. And that's what alcohol does. Okay. And again, I'll be sharing my contact information in the chat is already there. And I will be sharing with everybody in the group our webinars that we're having on March 19th and the 18th. It's going to be about poison prevention and medicine safety. So I will be sharing those flyers soon. Be safe.
Thank you. Can I add one more thing, Luz? So I'm Charlene Gordon from also the New York City Health Department, not from the Poison Center, Environmental Health Education Community Partnership Unit. So I wanted to say, Luz mentioned about Poison Prevention Week. So if you are close to Kings County, because it's in the area, on March 17th from 2 to 4, someone from Luz's team and myself will be at Kings County tabling, so it would be great if you could stop by, bring your clients over so that, you know, we can share information on Poison Center, about the Poison Center, and also you will learn a little about, you know, other environmental topics.
Excellent, Charlene. Thanks for reminding me.
No problem, that's what we're here
So
for.
many things and we're like, okay, yeah. Thank you so much.
Okay.
Anyone else? Your first time, if you have any updates.
Afternoon, everyone. It's Julia from District 79 Adult Education.
Thank you for the presentation. I had a deep question, but I didn't want to like run on the meeting. Um, but this is something to look into, especially data. You know, DOE is always driven by data, and it's very true, like how we utilize the data to affect like on the ground change is very important to all of us. With our adult ed programs in the East Flatbush area, you know, we did take a hit a couple weeks ago with all the scares going on with immigration, but I'm happy to report our students have came back. We're still, you know, continuing to work with them and your organization and even the mayor's office and the council members doing Know Your Rights workshops. All of the work we have all done is paying off because I do see our students are a little more empowered to you know keep going and to find alternatives regarding immigration and resources. Sorry, the lights went out. Hold on. Okay, you can still see me. With our program, we're still offering the GD classes in the evening and also Saturday mornings in the neighborhood next door. It's right on Rockaway. So anyone you know that they still want to continue their education, especially now, right before hiring season, definitely they can come to us. We can evaluate their high school transcripts, see what we can do to get them across the finish line. And thank you again. Thank you for the information. And let us know if we can help with the data collection. That's all.
Thank you, Julia. Anyone else?
Can you guys hear me?
Yes, we could hear. We could hear.
It's my first time here. My name is Alex. I use she, they pronouns, and I'm here with Canvas LGBTQ plus education acceptance project. We're in Flatbush, and basically a little bit of what we do is work to help support parents whose kids are LGBTQ plus and just encourage acceptance. So I'm dropping a flyer in the chat for this upcoming training that we're having on March 13th, which is a training for any service providers who want to learn a little bit more about this topic, especially if you work with parents and families, about how we can encourage acceptance in our communities. So I'm going to drop that in the chat, and I don't know, maybe I'll hope to see you guys there.
Thank you, Alex. I think we have Dr. Vanessa hands up.
Yes. Good evening, everyone. Thank you so much for having me. It's been quite a while, but I'm happy to be here. I am Dr. Vanessa Burrell out of Department of Health and not mental hygiene. I keep saying mental hygiene. We are the New York City Department of Health, Bureau of Early Intervention. I know it just keeps sticking in my head, the mental hygiene part, but nevertheless, I'm from the Bureau of Early Intervention. I saw my colleague Charlene is here and Luce. And I'm just here to remind you that we have our parent presentation. It takes a village to help children reach their full potential. It is a self-registered presentation. So families or providers can go on and select whatever dates that they want to come to this presentation. This presentation is delivered by certified licensed experts on early intervention live. So families, providers can come on. It is twice a week, and it starts at 6:30 p.m. sharp. And on weekend, it's 6 p.m. or 11 a.m. Sometimes it varies. We are here to talk to families about early intervention. And for those who do not know what the early intervention program is, it's a program for children 0 to 3 who may have suspected or known developmental delays or disabilities. There are two parts of the program. There's the early intervention part, and children will receive evaluations at that point. And then we have developmental monitoring, and that's for children who have been growing very typically. Everything seems to be fine. And then for some reason, whether it's a biological reason or a social, environmental reason, Luce talked about, they talk about high lead levels in the homes. Those are some of the factors. Children born premature with low birth weight children, or children who are just experiencing homelessness, abandonment, rejection, children born to families who have substance users. Okay, these children might be at risk for delay. So we monitor these children's development to run ages and stages questionnaire that we send to the families, and we address any concerns that these children may have. And our whole intention is to help children reach their full potential. So again, I did put in the chat a QR code that would take you straight to the registration page. Of course, it's free so that you can register. The presentation is 1 hour long, and it's designed particularly tailored for parents. So we have questions, Q&As, frequent asked questions. We address myths around referrals, confidentiality, etc. So I don't want to take up the rest of the evening talking. I could talk whole evening about early intervention. So I've put the information in the chat. If you need any information, additionally, you can email einow@health.nyc.gov. And that is all I have to say. I can say so much more. Thank you for having me. And this is a great group. I miss you guys. All right. Bye-bye.
Thank you so much, Dr. Vanessa. Karen did.
I just wanted to know, does Dr. Vanessa actually have the link, the QR code? If I download, I won't have it. So the chat, unless they're gonna forward it with a follow-up or something. Otherwise, do you actually have the link?
Yeah, so there's a link here in the chat and also a QR code. So you get to choose. And if you want more information, you could always email us at einow@health.nyc.gov, and that is in the chat as well. And we are also open for tabling. If you want us to table at your event or present to your group of staff or parents or anyone in your community, just reach out to us at einow@health.nyc.gov.
Thank you.
You're welcome.
Thank you. Anyone else? Okay, if not, then we will.
Yes, hi guys, I'm sorry, I'm driving. This is my first time coming to this meeting. I am standing in for Ting Feng. I'm Joyce from the New York City Department of Health. I am from the Bureau of Public Health Clinics. I represent our sexual health clinics and our immunization clinics. It is free, and immunization status does not matter. We also offer presentations for community partners on what we actually do. So if you guys need a breakdown or would like to for us to present to you, we're welcome to do it. And I did enjoy today's presentation, and thank you guys very much for having me.
Thank you, Joyce. Thank you so much. Okay, anyone else? Okay, if not, then could I just move on to the next slide? Yeah. I think the one that was the last of the meeting. The next date. Oh, yeah. Okay, yeah. So again, next meeting, March 27th. Thank you, everyone. Stay dry. Have a good day.
Thanks, everyone.
Thank you.
Have a good weekend, everyone.
You too.